Today, the trials begin. A lot more coming right up. Black Spring. And as always, well as the followers on Periscope. So thank you guys so much for all that you do and for breaking. It's breaking for many reasons. And it looks like we have a little bit of a buffering issue, but that happens around here. But the story that I have for you today, it may not come as a surprise, but we've been talking about this specific issue and it involves the vaccine. Now, the trials, if you've seen the thumbnail by now, you can see that it's entitled Trials Begin With. And we've had many conversations before. And we've even I'm not sure if you've heard or if you've seen any footage or any coverage on who they were actually targeting, who's going to be approached for this vaccine first. And it is going to be the Black community. Now, I want to give you guys just a couple of minutes to get in here. And it looks like, so I'm not sure. So before I get started, just a little bit on housekeeping. If you guys could do your diligence, of course, on the Channelytics, that would help out a lot. I really appreciate you guys taking care with that, either hitting the like, the unlike, or daring to share this stream out, or just making sure that you're still subscribed. Shout out to Chrysler Imperial H. Thank you so much, Chrysler, for all that you do. So I want to dig into this just a little bit, and I'm trying to give you guys a couple minutes to get in here because, the group that's targeted, as I just mentioned, happens to be the Black community or whatever you spin, the African American community. And I'm going to take you to that story first. Just have a couple of stories. This is almost a flash stream, but it's just enough to get you what you need and to get you on your way, get you on your Tuesday. So shout out to Chrysler Imperial H. So this is, I'm going to be honest. I'm just going to make this, in this is going to be a bit of an opening statement. We've heard the term conspiracy theory, and we just a second. Sorry. I'm going to get into this just a little bit. Now, of course, I'm going to take you to a bit of a release. Now, on August 11th, we have a release that I will be bringing to you, of course, from the Trump administration and its collaboration with Moderna. And then we'll talk about how the trials will indeed begin with the HBCUs. Now, for those of you that are not familiar with the term HBCU, the HBCU is basically an acronym for Historically Black College or University. Now, of course, if you haven't heard, that's been a part of the Trump administration's some of the talking points of many of the pundits, of many of conservatives, that the White House initiative on historically Black colleges and universities, that they're funding, that the Trump administration has actually funded or restored a funding, given it more of a permanent funding, more of an endowment that's there, because apparently the HBCUs were having to, I guess, request or actually appear or appeal for those fundings. And apparently President Trump actually provided more funding along with a 10-year backing on this, so that it's not a matter of them showing up to whomever and with their hat in their hands as if they're asking for or begging or groveling for the funding for the colleges. So that's the irony in this, that this is such a this is a thick issue. And there are two specific universities that have issued letters to their students, or released a letter in regard to the actual trials. So shout out to everybody in the stream. Shout out to Chrysler Imperial H. Thank you so much for all that you do on the channel and for the channel. Thank you so much for all your support. Shout out to Derek C. Williams. How can I forget? Shout out to the loyal patrons. Shout out to Derek C. Williams, Killer Whale Channels, The Definition of Anarchy, Chrysler Imperial H, Little Miss Goth, AZ, Infidel, Cold War Jesus, and Let the Truth Be Told. Thank you guys so much for all of your support on Black Spring with Autumn. So I really I did a video to West communities in Africa earlier this year, earlier in the spring. And so it's kind of interesting that the trials have hit the US and they're starting with the book. Really sorry about the couple of things going on here. So I'm going to put the camera on stop here, but I'm still here. So, yes. So let's just go ahead and get into this. I'm not going to take too long. I really appreciate you guys and all that you do. You guys make the difference around here. So what we're going to do is let's go ahead and go into this story. So apparently I'm going to share this on the screen with you. Thank you so much, Chrysler. I'm going to share this on the screen with you. So let's just start with, okay, so the Trump administration on August 11th, this was for immediate release from the HHS.gov. Now that's the U.S. Department of Health and Human Services, HHS.gov. Now, according to this, the Trump administration collaborates with Moderna to produce 100 million doses of the pandemic investigational vaccine. Now, under the leadership of President Trump, the U.S. Department of Health and Human Services and the Department of Defense today announced an agreement with Moderna, Inc. to manufacture and deliver 100 million doses of the company's pandemic vaccine candidate. Now, the federal government will own these vaccine doses. Moderna will manufacture the vaccine doses while clinical trials are underway. So, manufacturing in parallel with clinical trials expedites the traditional vaccine development timeline and builds towards the US government's Operation Warp Speed goal to begin delivering safe and effective vaccines to the American people by the end of the year. If the US Food and Drug Administration authorizes use as outlined in the in agency guidance, the vaccine doses would be distributed and used as part of the vaccine campaign. All right, quote, in creating a vaccine portfolio for Operation Warp Speed, the Trump administration is increasing the likelihood that the United States will have at least one safe, effective vaccine by 2021, end quote, said HHS Secretary Alex Azar. Quote, today's investment represents the next step in supporting this vaccine candidate, all the way from early development by Moderna and the National Institute of Health through clinical trials and now large-scale manufacturing, with the potential to bring hundreds of millions of safe and effective doses to the American people, end quote. All right. So the project announced, no, the Biomedical Advanced Research and the Development Authority, BARDA, part of the HHS office of the Assistant Secretary of Preparedness and Response, collaborated with the DoD Joint Program $1 billion to manufacture and deliver the vaccine doses to government designated locations across the country. The government also can acquire up to an additional 400 million doses of the vaccine. Now, the project announced today includes fill finish manufacturing in U.S. based facilities. This fill finish manufacturing step ensures the vaccine doses are packaged and ready to ship immediately, subject to successful clinical trials and FDA authorization. If these doses are used in the pandemic vaccination campaign, the vaccine would be available to the American people at no cost. As is customary with government purchased vaccines, healthcare professionals could charge for the cost of administering the vaccine. The vaccine, called mRNA 1273, has been co-developed by Moderna and scientists from the NIAID, that is the National Institute of Allergy and Infection Diseases, part of the National Institute of Health. The NIAID has continued to support the vaccine's development, including non-clinical studies and clinical trials. In addition to BARDA has supported phase 2 of 3 clinical trials, vaccine manufacturing scale-up, and other development activities for this vaccine. The phase 3 clinical trial, which began July 27th, is the first government-funded phase 3 clinical trial of a pandemic vaccine in the United States. So it goes on more to tell you that about Operation Warp Speed. Right, OWS is partnering among components of the DHHS and Department of Defense, engaging with private firms and other federal agencies, and coordinating among HHS-wide efforts to accelerate the development, manufacturing, and distribution of the pandemic vaccines, therapeutics, and diagnostics. So I just gave you just a little bit on that. But here's the ticker. I want to go ahead. Shout out to everybody in the stream. Thank you guys so much for coming in. Shout out to Philip J. Turner. Shout out to Chrysler Imperial H. Shout out to Patrick James Forums. Thank you so much. I really appreciate that. So what I'm going to do is I'm going to move on to the crux of what we're talking about. Ladies and gentlemen, the clinical trials, not the clinical trials, I want to say the trials have already started. Okay. So apparently the HBCU is another place where these trials are going to begin. So if you don't know what an HBCU is, as I mentioned earlier, then it's a historically Black college or university. So I want to bring you, there's actually a letter that's been released. And they are asking students to volunteer for these. They're asking the students to sign up for vaccines. Okay. So I'm going to bring you that. But see, even there's different stories about the manufacturers. You have one's being developed by Pfizer, one by BioNTech, and you got Moderna. So um, this is pretty. It's going to be pretty heavy, and it's going to be. I'm going to actually read you the letter. Thank you guys so much for tuning in to this segment of Black Spring with Autumn. Chrysler Imperial H says, thank you guys so much for coming in. And I am in and out of the camera today because of something going on here. I appreciate you guys and your patience. Thank you so much. All right. So I want to share the large picture. So I mean, there's all kinds of contingencies here. Shout out to everybody in the stream. Shout out to Philip J. Turner. Okay, so what you have here, what you see before you is you have the letter. Thank you guys so much for taking care with the Channelytics. This is not going to be a long stream. I just wanted to get this information out. So this was dated September 2nd, 2020. Dear students and staff and faculty of Dillard and Xavier Universities, our communities have been hit hard by the pandemic with harrowing consequences for the lives and health of our fellow citizens. Overcoming the virus will require the availability of vaccines effective for all peoples in our communities, especially our Black and Brown neighbors. Phase 3 vaccine trials have begun across the nation, including in New Orleans. So that comprise the United States. We, the presidents of Dillard and Xavier, are already participating in the Ochsner Medical System's current vaccine trial. As part of the study, we have received our injections and have been monitoring and reporting any symptoms and side effects. Upon our enrollment, we were fully informed, and any possible risk that would exclude us from the study were disclosed. We are both well. We appeal to the students, faculty, staff, and alumni of Dillard and Xavier and our sibling institutions to consider participating in this trial or others being conducted. The people and communities we serve look up to us as an example. Our participation in such studies will help find ways to better fight the pandemic. As presidents of HBCUs, we do recall unethical examples of medical research. We remember the Tuskegee syphilis study, which misused and caused harm to African Americans and other people of color, undermining trust in health providers and caretakers. Today, there are many regulations in place to assure the ethical execution of medical studies, including oversight by human subjects committees with diverse membership and participation of clinicians of color. Two of the leading physicians are Dr. Julia Garcia Diaz and Evans Laborde. We hope that you will consider enrolling. You may send an email. I'll let you guys have this link here, or leave a message to receive more information. We have before us a significant opportunity to serve and advance the cause for not just ourselves, but our sisters and our brothers suffering from the effects of the pandemic on their families and communities. We Dillard, we are Xavier. Now, this is signed by their president. Shout out to everybody in the stream. I'm sure I am. So I'll do as much as I can with it, but I'm sure the content might have some might be a contributing factor to this, because many people in the Black community are familiar with trials and the past when it comes to other experiments. So shout out to everybody in the stream. So I'll try to avoid the buffering, but I know one reason. BBC News released. This is what I'm talking about. This is what do you call something like this? The FDA is working with WHO. I mean, does this give you guys pause? I mean, I'm just curious. I mean, where does this begin? So hang on just one second. Hope you guys are doing well. So I'm going to try to get us through this without too much buffering. I'm working on it. Thank you guys for letting me know. So I'm just saying that, the Black community is number one. And a science experiment, a science project. So shout out to Okay. So this particular part is even more to me, more disturbing than the previous. All right. Shout out to everybody in this stream. So what I'm going to do is I'm going to take you to the actual story from not MSNBC. It's another network there. So let's just share this one here. All right. So according to this is NBC News. Americans will not participate are heartbreaking and disappointing. I have heard about the Tuskegee experiment a lot. All right, so this was written by, now this is even back in June, written by Curtis Bunn. Kalizia Hodges has an arduous task: persuade Black people who have a deep pandemic. It is quite the paradox. African Americans have been disproportionately devastated by the pandemic, but they are inadequately represented in human studies that would treat the disease that has claimed more than 116,000 lives in the US. Almost a quarter of those were Black, according to a study called Color of Pandemic by APM Research Lab. Okay, I want to stop right there. I'm not going to just. Here's the thing. These many people that have suffered from this thing had comorbidities. And when I say that, I'm meaning they had with me being a part of the Black community, I think it's valid. So if you have a pre-existing condition, whether it's diabetes or whether it's cancer or whether you have hypertension, if you're overweight, many of these things played a role in, and I think has played a role in some of those statistics. We're not even being given, we can't even rely on the CDC on the results that we've had or the tests that we've had. We've heard about deaths. We've heard about positive people that tested positive, but what we didn't hear was anything about recoveries, or we don't have a complete report on that. I think it's incomplete. So what I'm saying is, but see, they don't include that here. They don't talk about comorbidities. All right. So, and then it goes on to talk about some of the anxieties or the concerns about this vaccine. Okay. So, quote, and that's why I do what I do, said Hodges, a clinician at Infinite Clinical Trials outside of Atlanta. And that's why I'm here in this neighborhood that is predominantly African American, end quote. Okay, so African American participation in this trial is critical. Medical experts have said researchers are pharmacogenetics, yikes, science that studies how genetic factors affect reactions to the drug, stress that medicine could produce different results based on race and genetic, socioeconomic, and environmental dynamics. All right, translation, the vaccine might not work in African Americans if African Americans do not participate in the clinical trials to the drug. And so the power of persuasion ranks high on Hodges' job. She has to overcome the Tuskegee study of untreated syphilis in the Negro male, when infected Black men were solicited to be a part of a 40-year study from 1932 to 1972 to treat the disease with penicillin, and were offered free medical exams, free meals, and burial insurance. But they were not given the drug, and 28 of the original 399 Black men died of syphilis. 100 died of related complications. 40 of their wives were infected, and 19 of their children were born with congenital syphilis. The dark past remains a hurdle to clear. Quote, the reason I hear African Americans will not participate are heartbreaking and disappointing, end quote. Hodges said, quote, I have heard about the Tuskegee experiment a lot, and I have heard, quote, the doctors will give me the virus and, quote, they will put a chip inside me. Many say their parents raised them to never participate in medical research. It's all tough to overcome, end quote. So apparently there's a Dr. Larry Graham, a retired pulmonologist, who understands the lack of trust, but insists that African Americans have to get over it. Quote, genetics related to racial differences make it essential that we be involved in broad-based and diverse clinical trials of medications and vaccines, end quote, he said. Quote, the expanding of discipline of pharmacogenetics has taught us that we may respond differently than other races to both medicines and vaccines. We must be sure it works in Black folks. This can only be determined by our inclusion in the research-based trials of such vaccines. But Dr. Aletha Maybank, the American Medical Association's chief equity officer and group vice president of its Center for Health Equity, said she is concerned that there is not an urgency from institutions to include African Americans in the myriad vaccine studies underway. Quote, there is a fear with the pandemic how intentional the hundreds of trials are about diversity, end quote, Maybank said. Quote, I'm not clear and would make the assumption that they are not intentional. If so, I haven't heard about it yet. Quote, but if the distrust for the pandemic vaccine was strong, their chances are even less now that Black people will participate. I worry about exploitation and medicines being used on patients without their knowledge or consent, end quote. Hodges said that the pandemic human trials are at her location and will not occur for another month or two. So we're up to that month or two right now. So you might be, shout out to everybody in the stream. Yeah, well, see, that's the thing. But I think even Dr. Fauci, I've seen him mention that the Black community would be amongst the first. And even Melinda Gates has been quoted as saying the same thing. So I'm just thinking, this is not good, people. This is not good. So the thing about it is you didn't hear, I haven't heard one thing about comorbidities in these trials. Now, I don't know how the HBU students are going to react to this. This is where they're saying it's voluntary. But it sounds like a target. It sounds more like a target to me. So what I'm gonna put this link in the stream for you guys. Is this? I mean, it's a dense story. Okay. So I'm going to continue just a little bit with that. But see, of course, they're going to use Black people to convince Black people to do things that are risky. Do you guys picking up what I'm putting down? This is typical. Yeah. Get some Black people to convince these people to take this vaccine or try this. That's what they do. I mean, I think I've even heard of housing problems out here because it was actually released a few days ago. So, okay, where did we leave off here? So generally, we're discussing the doctors that have been involved with these trials, and they happen to be Black naturally, and I don't know. I'm concerned. I have my own concerns about it, and that does not hold anyone responsible. I have no idea. Shout out to everybody in the stream. I apologize for what's going on here with the. And I'm going to read some comments here. Crazy Chick Sheena says the Clinton Foundation and Bill Gates liberal hack Democrats are giving illegal tests to Africans in Africa now, and they have test trials in Poland and Germany. Well, absolutely. And then of course the vaccine is a baby. I'm not sure. I'm not sure. I'm not. I might think not, but I'm not. I don't remember. But thanks so much, guys, for tuning in. So, all right. So I'm not going to pull you through here. I'm going to put this link into the stream. This is from NBC News. So what they're doing is now. So what is it? The fate of the country depends on whether Black people take this vaccine. I'm not. But there's no mention of underlying conditions. Okay. So I'm just going to finish this one out a little bit. I might jump around here. Quote, with any relationship, you build it, end quote, she said. Folks doing relationships. Are you getting to know me beforehand? Are you speaking in a language I understand? Are the concepts broken down so that they are digestible? Are you present? Are you giving resources to our neighborhoods beforehand? That's not rocket science. It's building a relationship. That's how you build Open, the former president of Meharry Medical College and Morehouse School of Medicine, said a collection of historically Black colleges and universities that focus on public health is working to form a consortium that will focus on, quote, culturally sensitive a cure is different. Races have different genetic makeup and genetic impact. So it's critically important that clinical trials are across the spectrum of individual differences that pick up their minute differences Yeah, well, see, the thing about it is, I just think there's too much gray area here, and I think there's too many people involved. The fact that the Gates and the Gates Foundation and all of these people participating, having that it's even been associated with these names, it's going to be a problem for most people, not just the Black community, not just you know earlier experiments. So it's pretty problematic. So yeah, I guess that was almost the end of it. So I'll finish out here. It says Mopin acknowledges that the challenge is to change minds. That the challenge to change minds is quote. He said, "quote It will allow Black people to come. Quote We have to have more HB." I'm not saying all are untrustworthy. I'm saying there would be greater trust in institutions led by those who come from the patient's backgrounds. Hodges took it a step further. Quote, I often tell patients they have a chance to take a drug that not only could a previous version of this article misstated that the estimated percentage of Black Americans who have died from the pandemic, according to a study called Color by the Pandemic by APM Research Lab, almost a quarter of the more than 116,000 Americans who have died were Black, not more than half. So there you have it. I'm going to put this into the stream for you guys, but that is coming from NBC. So there you go. You have that article to chew on, and yes, so you also had the letter that I read earlier from the HBCU presidents. But I'm just thinking, this is nobody wants to be a part of a eugenics experiment or something that's going to have far-reaching ramifications. I don't know. I think it's pretty dangerous, and I can't. I I have strong concerns about it, but the fact that it's targeting, I see, and this falls right into that whole elite thing. You got your pets over here. Let's test it on the pets. Let's test them on the rats. Let's test them. Let's test this. I don't know if you guys remember the campaign back in the day. Send a mouse to college. Is that what this is? Send a mouse to college. Now that campaign. I don't when I talk about that campaign these days, most people don't have any idea what I'm talking about. Seriously, I mean, maybe it was the American Cancer Society. It was send a mouse to college. You had a little mouse, and you had send a mouse to college. American Cancer Society. So it's wonky, right? And then, so what I'm gonna do is I'm going to move on from that. I'm going to move on from that because I don't want to. I'm sure there's more that's going to come out. I'm sure that these trials are going to grow in number, and I will be following up with you on what happens beyond this particular reporting. So what I'm going to do is I'm going to take you to the next story. I hope everybody's doing well. Like I said, this is a bit of a flash stream, if you will. So we're going to go to the next story. So yeah, it's just, I'm surprised they haven't like swiped me or whatever, but it's public information, but you never can tell around here. So without that said, I'm going to take you to a story where it looks like a veteran is telling Biden some things that he probably doesn't want to hear. Shout out to everybody in the stream. Shout out to everybody in the stream. Okay, so let's go to that clip. Thank you guys so much for taking care with the Channelytics. I will tell you, I almost had a complete disaster before I started this stream. Well, it was a disaster. To me, it was. It was pretty close to a disaster. It's probably the biggest disaster you can imagine when it comes to streaming. So I'm going to show you this clip and then we'll have a little bit of backup footage. Shout out to Philip J. Turner. So I'm going to share this clip with you. And this is actually a tweet. This is Donald Trump Jr., an Air Force veteran, calls Biden out for voting for the Iraq war. So I'm going to bring you that and then we'll follow up on that and then we'll close out this stream. This is a flash stream, it's not scheduled, but I appreciate you guys for showing up and making a difference as you guys do. You guys do make the difference around here. So here we go.
I'm an Air Force veteran. Army veteran. Just wondering why we should vote for.
My son, he was in Iraq. For years. That doesn't matter, right? No, it doesn't matter. It matters a lot.
I'm sure it does. I'm not going after your son.
You better know.
I'm not. I'm not going after your son. You're disqualified, sir. Disqualified. The blood is on your hands. Blood is on your hands. No. My brothers and sisters died in Iraq and Afghanistan. And he enabled that to happen. He enabled that to happen. He is disqualified. He is disqualified. No way he can be president. They're dead. Millions are dead in Iraq. He will not be allowed to be president. Disqualified. Trump is more anti-war than Joe.
Fucking bullshit. Fucking imperialist. We actually fought in your damn wars. We fought in your wars. You sent us to hurt civilians. We hurt civilians. You pushed us out to do it.
No. Shout out to everybody in the stream. And I'm not sure. I guess you guys could hear that, hopefully. But it looks like Biden didn't quite wasn't prepared for that attack. Now, but that was posted by Donald Trump Jr., which he said, wow, an Air Force vet calls out Biden for voting for the Iraq war. Quote, we are wondering why we should vote for someone who voted for a war and enabled a war that killed thousands of our brothers and sisters. Their blood is on your hands. My friends are dead because of your policies. So we'll see. I guess you can't, as soon as he takes the streets from the basement, you're going to get attacked. So, you can't hide 47 years of policy and segregation, and you can't hide all of that stuff, right? Is it still muted? Okay, can you guys give me a 1? Give me a 1. Okay, thank you. You know, as soon as I start talking about these things, I know I'm hitting the right buttons. So, but there you go. No, I think you're going to hear more attacks or whatnot coming out of many people because we are 60 days or less, I think, to this election, and I think people are starting to feel the pressure, or it's starting to become real to some people. I think they don't. A lot of people, I think, have been sleeping on many things because there's just been so many things going on. I think it probably is broadband interference. I've had some issues with my ISP, and I'm probably going to yell at them, not yell at them, but tell them about it again. It's over and over and over again. So it seems that I can stop the camera here so I can keep going. So let me know if you get any more issues. But I just find these things are, they're pretty interesting. Um, but I tell you that the vaccines are that's a huge concern. And so I will put the other links in. Thank you so much, Philip J. Turner. And you guys, share and share alike wherever you can. I usually try to get over to your guys' pages. I usually try to do that. But this information is, I think it's an important time. It's an important time, and we just don't know what's next. So that I will tell you, the centerpiece or the jewel of this stream was definitely the vaccine trials headed to the HBCUs, which makes me think that this is makes me think that if these students are concerned, then at least they are concerned, because they don't know what's possible. No one knows. But I don't think that the send a mouse to college thing is going to work. And then, I mean, if you guys don't know what I'm talking about, you might Google it. You put $1 in your envelope and you send the mouse to college from your parents. You bring $1 from home. I mean, I think we did that in first grade or something like that. We did. Comments. I mean, because if you've got more like 750,000 followers, or if you've got 1 million followers, you're a much bigger threat than I am. Easy. You guys really make a difference around here, and it's really helpful because I do what I do independently, and whatever productions or whatever you are presentations, productions, or whatever, it's all done by me, and I really appreciate it. Some of the platforms are already shut down, so I try to support as many people as I can, and it's helpful. It's really helpful when you guys are supportive, and when you can. I would never suggest anybody support anything when they cannot, or when it's not convenient for them. So you guys being here, showing up, helping me take care of the channelytics, all of that makes a huge difference in what's going on here. So I really appreciate it. Thank you so much, Philip J. Turner. I really appreciate it. So yeah, everything that you guys do helps the channel. I don't know if, I guess when the election is over, they will stop. They won't care so much about, maybe they won't care so much about it. But for now, that's what they're doing. Fall as well. I might do an that are coming out. I do apologize. Is let me give you one more, and then I'm gonna say I'm sign off. Shout out to Old Head Deuce. Old Head Deuce says you are very smart. BSWA. Shout out to BSWA. Thanks so much, Old Head Deuce. And thank you so much, Old Head Deuce. I really appreciate when you guys come on. I open that up because I'm open to dialogue, and it's always nice to hear from you guys. It's not just about me. It's not just about an echo chamber. And I really appreciate you for engaging yesterday. And shout out to Crazy Chick Sheena, Crazy Chick Sheena. Always supportive, and I appreciate you being here. Shout out to Patrick Jane Forums, and congratulations, Patrick Jane Forums, for being monetized. So that's, we'll see. The thing about it is I deal with very provocative things on here. And, I've heard of some people that have gone up they've been trying to get monetized for 2 or 3 years. So, it's, I think, I don't mind playing the game, but we'll see. We'll see what I can do going forward. So I've got about 5 minutes, and then I'm going to close out this stream. So if anybody has anything, you definitely would come in under the 3-minute rule. So I will drop that, and then we got to hit the clock. Thank you so much, Philip J. Turner. Thank you. And thanks so much to Chrysler Imperial H. And thanks so much to Killer Whale Channels, Patrick Jane Forums for that. I may pursue this thing, but we'll see. We'll see. I can see the lines have been drawn, and I'm a little bit of a cynic. Not as my friend would say, I'm not a death by altruism, but I can be a little bit cynical, and but then a realist. So there you go. So shout out to everybody in the stream. And one more shout out to Derek C. Williams, Killer Whale Channels, The Definition of Anarchy, Chrysler Imperial H, Little Miss Goth, AZ Infidel, Let the Truth Be Told, and Cold War Jesus. I really appreciate you guys for all that you do, and thank you so much for coming in today. So if you see it right now, you got about 5 minutes before I officially close the stream, and I appreciate you guys for coming in today. Hope you guys have a good Tuesday, and maybe your Tuesday will exceed your expectations. Maybe it will. Let's see. So we'll see if I have anything. If I have maybe bring you out on a positive note if that's possible. We'll see if I can bring you. The thing is, it's not my goal to everything to be so dark or to be so. Thanks, old head dudes. You're here with us in spirit, without a doubt. I appreciate you. So it's not my goal to be the Debbie Downer or the bearer of bad news, but where do you get your news these days? So yeah, I mean, occasionally I open it up. I mean, I don't open it up all the time, but I try. When I do open it up, it's nice for you guys to come on. But I do have some guests in mind, and some guests that are actually kind of on a contingency lineup right now to come on. So yeah, I really appreciate all that you guys do around here. Thank you so much for the engagement and just for being subscribers. And thank you guys over on Periscope. So if there's nothing else, I will look forward to seeing you guys in a replay, in a video, the next live stream or the Moonlight streams. And maybe even for a rant. Really, this was rant material. This was in my mind, this was rant material, but I decided not to, and just try to get the information out, and we'll follow it up is what we can do. That's exactly what we will do. So I will look forward to seeing you guys later, and have a great rest of your Tuesday. Take care.